Sorry. It's like, oh my God, I can't find my mute button. No, I think that makes sense. I've heard all of these questions about, can we do something like to our facilities? Can we add some space? And, we're very flexible with the way that the funding is used, as long as, it goes towards improving the practice transformation efforts in your organization.
Mm-hmm. Okay, so it looks like there's no questions. And I mean, like I said, we're in halfways to in year 2 of practice transformation. So for you guys, it's like, oh, we already did that, But just keep in mind, for this year in July, you guys will be going into your 3rd year. So it's just 6 months ahead, but it pays to kind of think ahead and kind of have this have some ideas for when you guys are working on those proposed budgets.
I mean, I do know that there have been several organizations that have purchased vans for transportation. We heard from a skilled nursing facility that's what they had done with their funding. So, I mean, we're pretty flexible, and what that has done, it's been able to provide better transitions of care. So it's, as long as it's relatable to one of the milestones, I think that you're good.
Yep. And then one thing too, that I thought was, really innovative, even though it kind of like, oh, you're using the money for that. One of the skilled nursing facilities before COVID, they were planning on rebuilding this walking area that they had for their residents. It was really, the little path was really beat up, where it was uneven, that, there was a potential for somebody falling. So they were planning on using part of the money to be able to provide that to their residents. But then COVID hit, and just we know how everything went from there. But it was something that they were planning on doing with part of this money as well. Okay, so next, after we do the proposed budgets at the beginning of the year, and you guys are throughout the year, you guys are busy, working on the milestones, gathering data, implementing stuff. There's at the end of the year, we ask for a reconciled budget. The budget here, the reconciled budget, it says 15% over or under the proposed budget. So what happens if you're 15% over your budget? Say you budgeted, the 149,000, but you actually spent, like 180 or like close to 200,000. Or what if you were 15% under budget? If either of those two scenarios play out within your organization, then we ask to tell us why your actual budget differed from the planned use budget. But that's only if it's 15% over or 15% under. Then we would need those kind of clarifications as to, oh, hey, we budgeted, for 149,000, but we actually, once we were actually implementing stuff, we noticed that extra things needed to be purchased, that we went ahead and purchased those. So that's kind of an explanation for being 15% over budget. Some sites, on the other hand, have not been able to spend all of their budget that has been given to them through the year, because of XYZ reasons, that if you're not able to spend all of the money, then hey, tell us why. But what happens to that money then? Do you guys have to use it within that 1 year of practice transformation? The answer is no, but we would like to, as you guys are kind of getting the money, seeing, okay, well, we need templates for EHR. Let's put that money to that. But if you say, hey, we have the templates, we have the EHR, we have everything that we need, and we only use this much money for the year, that money that's left over can be carried over onto the following year, just as long as you guys are providing, that reasoning as to why you guys underspent on the budget or overspent on the budget. Are there any questions on this area here? Okay. Anything to add, Carol?
Nope.
Okay. Just making sure. Okay. And then as you guys are in year 2, at the beginning of year 2 for cohort 1, we added some mandatory items that they needed to report on. Those mandatory items, when that happened, you guys, cohort 1, was in the middle of your year 1 of practice transformation when these mandatory items came into play. When you guys jumped into year 2, these mandatory items became part of the reporting for you guys as well. And we'll go over some of the items here that are mandatory. And it might look like a lot of items that are mandatory here, but some of these you guys can already be doing. And it's just a matter of, hey, we are doing it, here's our information. And you guys are in the middle of year 2, so a lot of these mandatory items you guys are already reporting on, or if not, you guys are in the process of implementing and getting that information to us. And so here we have the MCO rosters. This applies to primary care only. So this wouldn't apply to cohort 2 since it's substance use providers and behavioral health providers. The screening of social determinants of health is one thing that is mandatory. And for this, we'll show you guys some examples as well at the end of the slides here of some of the mandatory items. The screening for SDOH, this is something that we are giving sites flexibility on how to implement that and what tools they are to use. There's no, use this tool because it's being, it's the standard. We know that there are, many issues, or you guys won't have the resources available to provide, say one person. See you, Carol. Carol left us. That the resources, because we want you guys to eventually act up on the data that you guys are gathering from these screenings. So if somebody needs housing, but you guys don't have those resources, what do you do? So we want you guys to be able to implement something that you guys will be able to act on. There's the conducting a daily team-based huddle. That's, quick 5-10 minutes to at the beginning of the day, middle of the day, just to kind of check in with your team and say, oh, these patients might need this, this, and that. Let's be on the lookout. Percentage of people screened based on your selections. This is on milestone 2. Follow up with patients after 1 no-show. Upload reports showing integration of bidirectional integration. MAT training, identification of MATs, referral or opioid resource network. So on the screening or on providing self-management support, there's a minimum requirement of 10% of patients receiving self-management support. So at least 10% of your patients with the conditions that you guys identified as being the focus for self-management support, that at least 10% of your patients receive that self-management support. Uploading reports to show the impact of self-management support based on measurements selected. Medication reconciliation is another mandatory item. Engagement of pharmacists as part of the care team. This for you guys, please ask your navigators as to how this will play out for you guys, because we know that for behavioral health, substance use, you guys don't usually prescribe any medications. So this will look different as how the engagement of the pharmacist as part of the care team will play out. So for this specific question, please talk to your navigator so that they can give you kind of, hey, this is how we're going to do this for this organization. So please contact them if you guys have questions for that. And then the same thing for the collaborative drug therapy management is mandatory for contracted or staff pharmacists. So that might not apply to all of you guys in cohort 2. And then please report the third next available appointment for the following appointment types. For cohort 2, you guys don't have adult wellness visits or well-child visits. So we're asking to only put acute visits or new patient visits that you guys are reporting on your third next available for these 2 types of visits. Continued, we have the increased percentage of patients that receive the surveys. So those are the patient satisfaction surveys. This one is increase the percentage of patients that receive shared decision making. And for these 2 items, I will mention that we know that for some sites, it's going to be hard to increase, their percentage, because you can say, hey, 100% of our patients are already receiving, the surveys, and they're also receiving the shared decision making tools. And so if you guys are in that spot, that would not apply to you guys. So as long as you guys keep that consistent, that should be fine. And then here, an attestation that there's a quality improvement team that meets with your navigator, review CQMs, the clinical quality metrics for your entire practice site on a regular basis, either weekly or monthly. Either or is the mandatory for this specific mandatory item. And then upload the identified Cqm reports for individual practitioner or care teams. And we just saw how much money is attached to that. And then meeting with your navigator at minimum once a month, utilization of collective medical once this is implemented, utilizing One Health Port. And then this is milestone 6 that we saw, the care coordination, where there's the follow-up after ED visits, follow-up after inpatient, and creating the collaborative agreements. Yes, we do have Cqm report examples. So, and those are our next. So here's the last one is participation in learning collaboratives and leadership council meetings. So that's another requirement on there. And the next, here's an example of the social determinant of health screening tool that one of the, I believe this is a cohort 3 behavioral health site that implemented this screening tool, which is from the American Association of Family Physicians, AAFP. So they implemented this screening tool, but there's a whole lot more out there, and you guys can actually even create your own if say these are too broad, or they don't really fit with what you're trying to achieve. Teresa, so from Triumph, so that's the one that they use. Good. And then here, reports, so upload report showing the impact of self-management support based on the measures selected, upload reports showing integration of bidirectional care, and upload of the identified Cqm report for individual practitioner or care team. So here's, this is the patient activation measure. So this is the first bullet point, an example of the first bullet point. So they'll go in order from first bullet point, second bullet point, and third bullet point. Here we have the PAM, which is the patient activation measure. So this is a screening tool that they provide for their patients to gauge their level of self-management. So there's different levels, level 1, 2, 3, and 4. And then here's the survey counts for each of the levels. And then here's the mean PAM score that they're scoring for each of those levels. So that's one example. Here we have, which one was this? This was bidirectional bidirectional care. So here we have provider quality reporting example. These are 2020 metrics, and they don't have to be super fancy. I mean, they can be really simple. Just this should be fine enough. In the first row, we have comprehensive diabetes care. So they're looking into hemoglobin A1C testing, a number of patients empaneled with A1C greater than 8, with labs tests completed within 1 year, divided by the number of appointments empaneled with A1C greater than 8. So we see here that they're dividing them by quarters. And so they don't have quarter 4 yet. So this was, now I'm sure that they do. Here we have the number of patients with depression screening and follow-up for adolescents and adults is the total number of patients empaneled. So total number of patients empaneled for the quarter and the number of screening and follow-ups that they did. And then here we have the number of patients 0 to 17 years with outpatient emergency department visits per 1,000 members divided by the number of patients empaneled 0 to 17 years. And then here they get their scores. And then here, this is 18 and over for outpatient emergency department visits. And, they're using the same methodology. And then patient experience with provider. So here's the patient experience for each quarter as far as the providers. And then here is quality metrics. It's a little bit blurry, but we can probably send you guys out a clearer picture of this. But this comes from, I believe, Pullman Regional Hospital out in Pullman. And this goes out as a newsletter actually to their organization. And they do a small write-up here, kind of an explanation saying, currently you can see that family medicine is 5 out of 8 above goal, and internal medicine is 2 out of 7 above goal. So here we have, they're doing good. And then for these last 3 measures, they're kind of in the red. Don't forget that these values are a slight lag behind real time. If you have seen closed a care gap for a patient after June 15, it is not represented on the current status. Our clinics have been working hard to close care gaps for patients. Please continue to address health maintenance with your patients. So this goes out to staff, within that organization. And then lastly, we have engage pharmacists as part of the care team, and then collaborative drug therapy management. Here we have an example of one of the sites that, hey, we do have a pharmacist as part of the care team, and we are in a collaborative drug therapy management. So if you're within an organization that you're able to have access to a pharmacist, then this would apply to you guys. But if you're a smaller organization that doesn't have a pharmacist, then this would not apply to you guys. And then here we have the MCO reporting roster. It's just an example of these are the numbers that we're getting from the MCO rosters that they're sending us, or that we're going into their portals to get. And then these are the number of patients from each MCO that we have in our EHR. And then for you guys, this requirement, Cohort 2, Year 2, will be required to contract or have collaborative agreement with primary care if they are not already integrated with one of the evidence models of integration listed under milestones 2B1, which is the BRIE collaborative co-location, or the AIMS model. And from here, we should be able to go back into the main lobby. So if you guys can go ahead and leave the breakout room, we will meet back in the lobby.
All right, we should be getting everyone back to the main room here in the next 45 seconds. Okay, I think we're all back, Sam and Diane, if you want to go ahead and take over.
Deb, did you want to go ahead and wrap it up for us?
Actually, I want to ask how everyone liked the breakout rooms, if that was beneficial for them or more productive, I know that it was a lot of information to cover and very different information to cover. So I'd like to have some feedback on that, please.
This is Teresa Atkinson from Triumph. I just wanted to say I liked it because it was nice to have all the information just apply to the cohort that I'm in. So it was really relevant and it wasn't kind of a bouncing back and forth between like, well, if you're year one or year.
Thank you. Diane, do you want to read some of those in the chat box?
Sure. So it said that, let's see here. Hold on. Gotta go up a little bit. That it worked really well for them. The slides were excellent and they allowed plenty of time for them to ask questions. And Holly Kaiser said she appreciated the information. It was applicable to the cohort specifically, and Laurel did a great job to review the information. They said that it was good information.
I would like to share one. Go ahead.
Thank you.
I would like to share one bit of information. There is a request for a learning collaborative. Rhonda Hoff, if you're still on, can you please share that information?
Well, Bertha brought up the comment about having more learning around the topic of racial equity or health equity. And I was sharing that last year, some of you may have participated in the trauma-informed care presentation that was done by Ken Crabel. And he's a partner in an organization called C4 Innovations. And I've worked with him in different realms for several years, but his group is actually all over the country, and with all things virtual, it's very it works very well for us. But our organization has engaged him to do management training for a year. Every month we have a session for our managers. And we started with self-care in the world of COVID. We've done organizational culture, and this month the topic is on diversity, equity, and inclusion. And the presenters are all over the country, and our presenter this month is on is from Boston University, and the topic is racial equity. And there's a whole list, but it's been very affordable because all of our topics are virtual. So Diane has, I think, the information, and she's offered to send it out. They also have podcasts. We didn't talk about that, but they have podcasts that go out. A lot of them are free. I think Diane said that there are presentations online that occasionally are free as well. And so if that's something you're interested in, you should check with Diane about that.
Yes, and we have all that information. And so what we're going to do at the Leadership Council next week, we are going to ask for topics of like things that people want to learn about, and that could include the learning collaboratives. Like I said, we do have a little bit of funding that we could put together some kind of other special learning things like we have in the past, like when we brought Allison Masari, and Ken Crable has come a couple times and talked about self-care, and he's also come and talked about some of the he did the trauma-informed care. So yeah, we definitely have opportunities to do that. So it would be good to know what people really want. And Berta, she's from Virginia Mason Memorial there in Yakima, and she was the one who had asked about the equity, and so that's when Rhonda brought up the Ken Crable again. So I can reach out to him, and if anybody wants their information, I have that as well.
Hi there. I am wondering if you help with alcohol outpatient treatment.
We have a lot of so our cohort 2 has some substance use providers.
So Monday and Tuesday at 11:30.
Sorry, but I think she's not talking to me.
Okay, and
I muted her.
Thank you.
Sorry. I was wondering the same thing.
I was like, well, I could get you to Triumph, or I could get you.
TGIF. Sam, Diane, I just threw up the information or the dates for our next Leadership Council and Learning Collaborative.
Thank you.
Thank you, Chelsea. Chelsea, can you go through the questions that are on the chat, please?
I don't think there's any questions. Everybody just said their thank you. It was great.
Yes, the slides. I see one question about the slides, but we will be sending these out following the convening, and you should be able to find those on our website as well on GCACH.org, and they will be uploaded to the CSI portal. So plenty of different places to find them, but you should be receiving them directly in the next couple days.
And if there's no further questions, and Diane, Carol, Chelsea, if you don't have anything else to add, we'll give them approximately about 8 minutes back of their time.
Thank you, everybody. We'll see you at the next Learning Collaborative.
Thank you.
thank you.
Nice job, guys.
Good job. See you next time.